listen to wonderful program coming to you. And please don't forget to subscribe or give us thumbs up. Thank you for watching.
Okay, so hello. In the studio today we have Miss Mary Nyabonyi Masese. She's a healthcare professional. So we're here to talk about uh, drug abuse and how we can support our kids or anybody who's going through drug abuse challenges. Welcome, Miss Mary.
Thank you.
Yeah, so glad to have you. Please tell us a little bit more about yourself.
Oh, like you said, my name is Mary. I'm a healthcare worker.
Yes.
I'm a parent of young teenagers
Yes.
and older children as well.
Yes. Yeah, and just so glad that you could make it here today because we are struggling. I mean, times are hard, and we are always trying to figure out how do we support our kids here because we have a difference in culture, and we are struggling. We are really struggling. So, yeah, I will. Ask you, to just tell us a little bit more about what you think about drug abuse right now in the United States.
I I mean, it's been there, but I think I can say we are seeing. I'm seeing more of it because
Hmm.
it hits close to home.
Yes.
I used to be something that you hear and it's supposed to be out there, but not with us.
Yes.
But it has hit home and it's here with us.
Yeah.
So whether it's increasing or not, it's home and we have to deal with it.
Yeah. And I do agree. And especially with COVID, I mean, because I know you're in healthcare, you've been working with a lot of patients. So do you feel like this is more with when COVID hit? I mean, do you feel like drug abuse has been more pronounced, and especially with our teens, or it's always been there, but we didn't maybe catch it?
I think it's more because of COVID,
Mm-hmm.
because of the restrictions with gatherings and social gatherings and all that. It's more everybody's feeling more isolated.
Yes.
So then we find that substance abuse is something to fall on for comfort.
Yeah.
Yeah.
You know, I agree with you, and I guess we are struggling, so we don't know what to do. And now we are seeing a lot of our kids struggling too. So I just want you to let us know, like, what would you say if you have a child, for example, who is struggling. Maybe she went out there and she was given some drugs and she experimented. Maybe she had an overdose, and then you get a call and they're telling you, your child is in the emergency room and, she overdosed. What would how do you advise a parent who gets news like that?
Number one is devastating to know that your
Yes,
child is going through that.
yes,
Maybe you didn't even have an idea that your child was taking the substance.
yes.
Now that you've been made aware,
Mm-hmm,
I mean, you're gonna be in denial, obviously.
mm-hmm.
Um, so this parent has to acknowledge first that it's real, it has happened.
Mm-hmm.
Yes. And
Okay.
first thing first for me is to listen to the parent,
Yes.
non-judgmental.
Mm-hmm.
Um, learn their struggle. Maybe they have struggles all along.
Mhm.
They may not open up right away, but just give a listening ear.
Give it, so like just listen to them so that we are not judging them
We
and
are not judging them, and that's the only way. That's a way they can open up.
okay.
Yeah.
So what are so a lot of our children, especially the ones who've grown up here, so when they go to the hospital, sometimes they may decide, okay, I really don't want you to tell my parent about, what happened. And if they're even slightly over, at the age of 18, sometimes uh, we don't even know after the fact. So
Mhm.
after we support them, what else would you say that we would do just so that we can be able to, know what's going on with them and, how this whole happened.
Well, that's for me. I can say that's a challenge,
Mm-hmm.
and it's kind of difficult because if they are of that age and even younger,
Mm-hmm.
they can choose they don't want the parent to know what's going on with them,
Yes.
and the healthcare worker is going to respect that.
Mm-hmm.
But then, so if the parent doesn't know,
Mm-hmm.
truly they may not be on the they may not be able to help them because they don't know what's going on.
Mm-hmm.
But if the kid opens up to them,
Mm-hmm.
of course it's going to be shocking to the parent, like I said earlier.
Mm-hmm.
But acceptance for me in the part of the parent, it's not easy to accept it, but it has happened. So accepting that this your child is taking the substance
Mm-hmm.
is the key to starting to help them because it's gonna be a team effort.
It's gonna be a team effort.
Yeah.
I agree with you. So accepting and just saying, we are here now. It has happened, so we are going to deal with it instead of judging them. Uh,
Instead of judging them and we are quick to throw them out.
yes.
You know, they're gonna seem like these little devils that you can't let in your home.
Mm-hmm.
Yeah.
Yeah. Yeah. And so, do you think so with say for example, we are dealing with parents who grew up in Kenya or grew up in another country, for example. So sometimes it might be so hard for them to accept that these kids are using, and sometimes what they're using is it's not alcohol, it's not marijuana. Maybe you find out that they're taking heroin, cocaine, or they're using meth. And so how do you so say when they're being discharged from the hospital, how do you explain to the other kids that your sister or your brother is struggling, we need to embrace them? What are some of the ways you'd advise some parents out there on how to talk to the other family members so that they can accept these kids back in the home?
Okay. Number one,
Mm-hmm.
as a parent who is from another culture,
Mm-hmm.
it's gonna be hard on my part
Mm-hmm.
to accept it and to even know how to deal with it.
Mm-hmm.
And not only from another culture, even my parent who has never been exposed to substance abuse, drugs, and alcohol. This is a new game to me.
Yes.
So I'm gonna have to learn how to deal with it first, on how to what to look for
Mm-hmm.
before I even start telling the other siblings of the other kids on how to react to their brother or sister.
Mm-hmm.
And also it may depend on their um, how old the other siblings are.
Yes.
their maturity level, because they may even know more than I do.
Mm-hmm.
Even if they're younger or older, they may understand, and they've seen these things out here more than I have.
Mm-hmm.
So my own understanding,
Mm-hmm.
my own worldview of this world of drug and alcohol
Mm-hmm.
abuse
Mm-hmm.
is going to determine on how to handle the case from,
Mm-hmm.
to deal with the kid, and how to influence the other siblings to relate to this kid.
Mm-hmm.
Yes.
Okay. Um, so supporting the children who are going through drug abuse. So we know religion is a big deal, and we can't negate that fact.
Yes.
Yeah. So I would like you to tell me how we integrate, or how do we talk to leaders, or to the kids that have grown up with our kids, and tell them, what, something happened here, our kids went astray. So how do we talk to our community about what's going on? Because sometimes there's so much shame, and sometimes parents feel like, oh, you know what, maybe I failed somewhere.
Um, that's all about, that's where stigma comes in.
Mm-hmm.
And for the parent who is going through this,
Mm-hmm.
I mean, this is something that's not supposed to happen to begin with.
Mm-hmm.
Yes, you feel like a failure.
Mm-hmm.
You failed your children.
Mm-hmm.
Um, then how do you face the community?
Mm-hmm.
Obviously, may not understand, how this came about.
Mm-hmm.
Um, some of them may have younger children who, they have no idea, because their children are much younger, and they don't even they can't even think about it. I mean, it's like, how does that happen?
How did this happen?
How did this happen? Some of them maybe they've been lucky that their kids haven't gone through that,
Okay.
so they don't get it.
Okay.
So, and some of them maybe they have gone through it, but they have, worked around it without exposing themselves or the children.
Mm-hmm.
Maybe it was bad, maybe it wasn't, but stigma is a big issue for me, I think.
Mm-hmm. Okay.
Yeah.
Yeah. So I agree. So now, how do we reintegrate them back? Because some of our kids grew up in the church. So how do we reintegrate them back to the community, so that, whatever they did when they were younger, then they can always go back and do that without the shame?
That's where we talked about being non-judgmental.
Mm-hmm.
That's where that all goes back to, are we going to be able to accept them without judging them?
Mm-hmm.
Are we going to be able to accept them back without telling our own other children to stay away from them?
Mm-hmm.
Because if we know that this kid is taking drugs
Mm-hmm.
or has been involved,
Mm-hmm.
obviously we don't want I don't want my kids to be with them.
Yes. Yes.
Yeah, so it's like, uh, we have to accept them, but how are we going to accept them when we are a community that's judgmental?
When we are a community that's judgmental, and then one thing that I have had is a lot of the kids who've had drug abuse, like, issues. They've been addicted. Sometimes when they try to go back to the circles of friends that they had, even going back to church is a struggle, because now the parents are saying, I don't want to see you with so and so's child because, oh, they have a drug issue and I don't want you to be like them. Then they they start being lonely, not being able to attend the social circles that they had before. So yeah, that's really it's difficult. So how about the parents? Because the parents also suffer shame, and then they're thinking, okay, maybe I did something wrong, maybe I didn't bring these kids up right. So what would you say to encourage the parents who are raising these kids? And a lot of the parents go through this pain, um, and they don't want to share, they don't want to talk about this because they think, like I said before, maybe they did something wrong. So how would you encourage these parents?
Um,
Miss Mary, quick.
I can go ahead.
Yeah, no, I wanted you to move a little so that we can see your face. Yay! Now we see you more. Okay, there
Okay.
you go.
I can say, for the parents who are going through this,
Mm-hmm.
it's not their fault.
Mm-hmm.
And maybe if there's something they might have done,
Mm-hmm.
well, it's too late now. They can't
Mm-hmm.
go back to it. They can't go back and change the time.
Mm-hmm.
So how the focus is on what's the way forward? How do we move from here to
Mm-hmm.
support this kid?
Okay. So
Yeah.
really. Mm-hmm.
So it doesn't really matter if, I mean, you have this problem already you are dealing with.
Mm-hmm.
So what happened, how it happened,
Mm-hmm.
what you might have done that you didn't do really at this time, it's useless to go back and, I wish I could have done ABCD. It's not gonna help you. You can't pick yourself at this point, and you have to work to be strong,
You have to work.
so you can help this kid. It's hard,
Mm-hmm.
and it's hard, and I think
Mm-hmm.
the parent is gonna need more support
Mm-hmm.
even than the kid, this child,
Mm-hmm.
depending on how they handle the issue,
Mm-hmm.
and if this kid is even going to allow the parent to be involved.
Mm-hmm.
Yes.
You bring a good point across. If this kid is going to allow the parent to be involved, what
Yes.
if what if this kid decides, you know what, I do not want my parent to be involved? Any advice? How do you deal with that? Because then you know what, the parent is feeling rejected. They want to reach out, but this kid doesn't want any parent involvement. How do we deal with that? What is your advice on that?
That happens a
Mm-hmm.
lot than we think.
Mm-hmm.
And we may think maybe the parent gave up on their kid, and this kid is, kids end up being homeless,
Mm-hmm.
run away from home. If they're younger, they run away kids. If they're older, they're over 18, they're out there homeless,
Mm-hmm.
without a job, without a house, a place to stay.
Mm-hmm.
And because they don't want to deal with the parents,
Mm-hmm.
because number one, to them, the parent is unreasonable,
Mm-hmm.
um, and they may feel like the parent is disrespectful.
Mm-hmm.
They are getting too much into their business.
Mm-hmm.
They are not giving them that space. So it's kind of hard. I mean, as a parent, do you want your kid to be in your house doing drugs? No. Do you want them to be out there homeless? No. So that balance is kind of hard.
Yes.
That's where we, I believe, we need to get this kid into some treatment program that can help them before they move. If the parent is going to accept them to come home, need to be going through some treatment.
Okay.
Because I know there's some, outpatient, inpatient programs out there these kids can go to.
Yes.
So, because the parent may not feel comfortable with this kid at home, maybe
Yes.
they're displaying some behaviors that she or he or the parent may not feel comfortable with, especially if they have younger or even other kids in the home.
Yes.
It's a challenge.
It's a challenge. And
So,
I yes. Sorry.
so for me, the support to these kids is getting them through therapy. I mean, having the parent also through therapy, not the kids alone, but the parents, if they're having a hard time adjusting, accepting. Yeah,
Okay.
some support group or something.
Okay. So a support group for the both the parents and for the children.
For the
Um,
yeah,
for
for
the
the
child who's
for the child involved, for the other kids if they need it, you know, not for the parent. Yes.
and for the parent. Yes. So now something that you said that I really want to follow up on was the drugs, the effects of the drugs on these kids, and because sometimes some of these drugs could cause hallucinations. Some of the drugs could cause violence that we never experienced. So I really do agree with you that what we need to have these kids go through some kind of program where we are able to, they're able to be monitored, and then we make sure maybe the drug is out of their system before they come back. Because here, man, we have had stories of where, kids were intoxicated or they had taken a drug and they were not themselves. So, they have done things. They even, we heard about the young man who's 16 years old who killed his girlfriend. And he was under the influence of marijuana. So, yeah, I really do agree with you on that. So, as a parent and as a healthcare professional, I mean, eh, what do you think? Is it hard to, talk to your patients and then come home and it's like, okay, so you know what? Now I have to be a parent. How do you juggle that? How are you able to integrate those two?
I didn't get that one.
So, are you able to relate? Because sometimes, when you're a healthcare professional, you have a protocol that you follow. Then when you get home, you're like, you know what? I have to be a little lenient. So how do you juggle that?
It's not the same when you're out there as a professional. When you get home, you're a parent. You kind of you don't keep those boundaries because these are your children. Yes.
Yeah.
Yeah.
Yeah. So what would you advise parents, especially the ones who are struggling with our, children who've run away and they don't want to, integrate or talk to them. And then now move over. We want to see your face.
Yes.
Okay, very good.
Yeah.
I'll see you more. Okay. So what did you tell those parents? How are we able to support them? Because those parents are struggling. They're like, this is my little girl, or this is my, young man. This is a boy that I raised, and all of a sudden he's not here, and he doesn't want to talk to me. How do we deal with that?
It's really hard when you know that your child is out there, they don't want to talk to you, they're not answering your calls,
Mm-hmm.
maybe they've turned off their phones.
Mm-hmm.
So what's going through your mind? Are they okay? Is something happening? I mean, are they safe wherever they are?
Mm-hmm.
I mean, they are not answering their calls. If they're answering their calls, they don't want to talk to you. I
Mm-hmm.
mean, are they going to hurt themselves? There's so much that has to go through your mind at this time, and it's like, how can you go to bed not knowing where your child is? Maybe it's an underage runaway kid. Maybe it's an older child who uh, is not responding to you, and you know they are unstable.
Mm-hmm.
So it's hard, and for me, I think what I think as parents we should do is know who our children's friends are,
Mm-hmm.
because when you can't contact that child, then you know their friends, and you can call their friends. Hey, have you heard from so and so?
Mm-hmm.
Can you ask them to call home?
Yes.
Then maybe those kids can tell you, hey, I talked to her, she's at this place and she's okay. Then at least you can settle down a little bit.
Yes. I
Oh,
agree with you.
yeah. So as much as we may think their friends are a bad influence,
Mm-hmm.
they are also, those are their friends, those are their family. I mean, they mean more to them than anybody.
Exactly.
As young children, young adults, underage kids, their friends are everything.
Exactly.
Their
Yes.
friends are more than their family. So we cannot shun away from them. We have to know them,
Yes.
unfortunately.
And we have to know them. Yes. I
We
agree
have
with
to
you.
know them regardless of who we think, what kind of bad influence they are. We
Yes.
have to know them.
Yes. Yeah. And I agree with you. So, make sure we know their friends. And then, what is the most difficult situation that you've had to deal with, with your child? Because what I am hearing from parents is, every time that they are told, oh my gosh, your child was smoking this, or,
Mhm.
drinking this, then, hmm,
Well, trust me, I've had my own shares.
I never.
I've dealt with a runaway, child.
Yes.
So yes, I have.
Okay.
Yeah, I've dealt with
Mm-hmm.
yeah, substance abuse.
Mm-hmm.
Yes, so it happens.
It
It
happens. Yeah.
happens. I mean, it happens, and it happens more than we know.
More than, yes, more
And
than.
and and some kids will be open about it. Some kids
Mm-hmm.
will be like, my parents can't know.
Mm-hmm.
Yeah.
Yeah. Yes.
Mm.
Very powerful. One thing I'd say is, sometimes I think, we are people, don't want to discuss situations that are like, oh my goodness, you know what? No, no chance. I'm not going to, tell you what I've done. But I think just hearing it, and knowing that, you're a healthcare professional, you have, you deal with uh, kids, and you deal with young adults, and you've gone through it yourself.
Mhm.
So I think that would be so important. Even, when we bring a forum together, I think parents would love to hear, from you, because hey, who better knows than somebody who's gone through it?
Yeah.
Yes, yes, yeah. And sometimes things happen, but really, experience can be good, and it can
Mm-hmm.
also be detrimental. Yeah.
Yeah, experience is good. Yeah, that's true. Yeah.
Hmm.
I mean, I have had my own experience.
Hmm.
May not be as bad as the other people out there.
Yes,
It may be worse than others have gone through.
yes.
So, I mean, sometimes too, it's as parents, especially if this is your first experience,
Hmm.
it might not be a big deal,
Yes.
but you can make it a big deal because you've never experienced it before. And
Yes.
it's like, this my child is not supposed to be like it, so no. You might make it bigger than it's supposed to be. And I believe that's when these kids don't want to deal with you because to them you are unreasonable. You are too harsh for nothing. You
Mm-hmm.
know?
Yes.
Yeah.
Yeah.
I
Like.
mean, yeah. So, and we have kids grown up here who
Mm-hmm.
have grown up here who
Yes.
might use some words that
Some words, right?
that would not sit with us culturally, will not sit with us, and it's like you cannot say that to me. You cannot use that kind of language in my home.
Yes.
So you better cut it off or out the door.
Right.
So I believe culture
Mm-hmm.
is a big thing. I
It's
mean, because of that culture, religion, we can push our kids away.
exactly. You're
We
right.
can push our kids away because of they have grown up. We brought them up here.
Mm-hmm.
They're our children,
Yes.
but they have grown up in this environment
Mm-hmm.
which is completely different. We don't understand it yet.
Yes.
And yeah, we may never understand it because we choose not to. It's
Yes.
hard for us to change.
Mm-hmm.
So little things to them
Mm-hmm.
is huge to us.
Exactly.
And I believe through that we end up pushing our children away.
Yes. We end up pushing them away. You're right. Yeah. So then, one thing that would love to follow up on is the programs, because I think we don't have any programs out there that support our kids, and
Mhm.
because of the culture, I think our kids are might not fit in well with
Mm.
the other kids here. So we will have a follow up session where we'll talk about the programs, and I know you are very passionate about it, and we want to see your face again.
Yeah.
So this way, okay, okay. There you go.
Yeah.
All right, there you go. So we will follow up, and then discuss about those programs. So the inpatient, the outpatient, and then